Welcome to the Medical Terminology Podcast on iTunes U at JCCC. This episode is Chapter 2, Part 5, Pathology. In the last part of Chapter 2, the textbook presents some terms that describe various types or categories of diseases and disorders. These terms can sometimes be confusing because it can sometimes be difficult to tell exactly how they relate to each other or what the exact differences are between them. So what I'm going to do is go over them with you, and I'm going to present them in what I hope is a more clear way, with more of a hierarchy that will show you how they relate to each other. First of all, there are two broad types of diseases and disorders that we can talk about. The first type is called the organic disorder, organic disorder. Now, an organic disorder is one in which the patient has symptoms that can be explained by physical changes in the body. These are like most of the diseases that we think about. For example, if someone has a disease like arthritis, a doctor can examine the patient, can do some procedures, and find observable changes in the joint that's associated with inflammation. On the other hand, another type of disorder is the functional disorder, functional. Now, a functional disorder is one in which the symptoms cannot be explained by physical changes in the body. Now, the symptoms are very real. They affect the patient. The problem is, if you do a physical examination, you can't see any physical, or we'd say organic, changes in the body. A common example of that you may have heard about is the irritable bowel syndrome. In irritable bowel syndrome, a patient can have symptoms such as diarrhea, constipation, severe pain in the gut. They can have a lot of passing of gas. These are very real things. The problem is, if a doctor were to say do a colonoscopy on the patient and actually look at the colon, they wouldn't see any physical changes. There would be nothing physically wrong with the colon. The problem is how the colon is behaving. It's functioning. Now, in contrast to that, suppose a patient had, say, colon cancer. The patient goes in and has a colonoscopy. The doctor's going to see tumors in there. The doctor's going to see physical changes inside the colon. So that's the difference between a functional disorder, one in which it's a change in function, but there's nothing physically that can be identified as wrong, and the organic disorder, in which if you go in there and observe the patient, do procedures, you're going to find physical changes in the body. Now, beyond those two broad types, then we can go on and talk in more detail about causes of diseases and disorders. The first term to talk about is a term called pathology, Pathology, and that is the study of the nature and the causes of diseases. Now, a sub-study of pathology is etiology, etiology, and that is specifically the study of the causes of disease. If we talk about the etiology of a disease, we're talking about what caused it. If we're talking about the pathology of the disease, well, we're talking about what caused it, but we're also talking about other aspects. Now, when we talk about the causes or etiologies of diseases, there are some other terms that we use. The first term is idiopathic, idiopathic. If a disease is idiopathic, the cause is unknown. We don't know what causes the disorder. Now, it's important to distinguish that from, say, a functional disorder. An idiopathic disorder could be either organic or functional. We could have a disease process going on and we just don't know what causes it. This is different from saying that we have a disease process and on the one hand there are actual physical changes observable in the body, which we may or may not know what causes them. and saying, well, there aren't any obvious physical changes in the body. We know there are symptoms, we know something's going on, but we don't have physical changes to identify. The next term is an iatrogenic disorder. iatrogenic. An iatrogenic disorder is caused by an unfavorable response to a prescribed medical treatment. Now this one is often missed on tests. Student sees a question, what is the term for a disease or disorder that's caused by an unfavorable response to a medical treatment? And they'll say something like side effect, or they might say adverse drug reaction. Well, that's not really what we're talking about. This term is broader than that. The textbook talks about the example where someone undergoing radiation treatment can develop severe burns from the radiation therapy. And notice that the radiation therapy isn't a drug, so a drug reaction wouldn't apply to this. The third type of disease or disorder that they talk about is the infectious disease. An infectious disease is caused by a living pathogenic organism, such as a bacteria or a virus or a parasite. And when we say it's a pathogenic organism, it means it's disease-causing. Pathogenic, P-A-T-H-O-G-E-N-I-C, means disease-causing. Now, an infection occurs when the body is actually invaded by the pathogen. Infection, I-N-F-E-C-T-I-O-N, means the body has been invaded by the pathogen. Now, when we talk about these infectious diseases, there are a lot of subtypes or sub-causes that we can talk about. First of all, we can talk about whether the infectious disease is communicable or not. Communicable, C-O-M-M-U-N-I-C-A-B-L-E, means that the infection can be transmitted from one person to another, either by a direct contact or an indirect contact. So communicable diseases are diseases that are easily passed from one another. Good example would be the common cold. If someone coughs in your vicinity and you breathe in the droplets from their cough, then you can catch the common cold because it's present in those droplets. Or you could touch something that someone else has touched, and when that person touched it, they transmitted the virus to that surface. Then when you touch it, you pick it up, you touch your face, then you've got the disease. That's a communicable disease. It can be easily transmitted from one person to another, either directly or indirectly. Now we can be more specific about this and talk about the specific ways that infectious diseases can be transmitted. And there are several different ways that are talked about in the textbook. First of all, they talk about blood-borne transmission. Well, blood-borne transmission means that it's transmitted from one person to another by contaminated blood. A good example of this would be the AIDS virus, HIV. It is transmitted through contaminated blood products. Second type of transmission is foodborne. Foodborne transmission means that it's transmitted through contaminated food. And a good example of this, of course, is food poisoning. There's various types of food poisoning. In the news quite a bit lately, there's been the E. coli bacteria that people have caught by eating meat products or vegetable products that have not been sufficiently cooked or cleaned, washed, and they are picking up the bacteria from that food. The third type is the airborne transmission, and we already talked about that a little bit when we talked about the broad category of communicable diseases. And again, the common cold or the flu is an excellent example of an airborne transmission of infection. Finally, the textbook talks about the vector-borne transmission. Now, when we use the term vector in this context, what we really mean is an insect or an animal. The insect or animal carries the infection, and then when the animal comes in contact with the person, or say the insect bites the person, then a person can become infected. And a good example that's been in the news quite a bit recently is the West Nile virus, which is transmitted by mosquitoes. Now, another disease category is the nosocomial. 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 This is a term that describes an infection that is only acquired in a hospital setting. There are certain disease organisms, bacteria, that you just only find in a hospital or clinic setting, and it would be extremely rare for you to ever contact it or to catch it unless you were, unfortunately, had to stay in a hospital. Now, an example of a nosocomial infection that is unfortunately getting out into the broader population is the MRSA, the methicillin-resistant Staphylococcus aureus. It's sometimes referred to as MRSA, and you may have seen in the news recently where some students in a school back east were infected with this from a computer lab. The bacteria had gotten onto keyboards in the computer lab, and the students had touched the computer lab and they had picked up the infection. Finally, it talks about different types of disease outbreaks. When we talk about a communicable disease, an infectious disease, it can be spread around between people, and we can have outbreaks of them. And a person who studies disease outbreaks is an epidemiologist. Epidemiologist. An epidemiologist is a specialist in disease outbreaks within a population. If something is endemic, it's going to have an ongoing presence within a population. An epidemic is going to be spread over a wider area, and it'd be more random, and it's not going to be ongoing. An epidemic will be a big breakout and then it will slow down. And then finally we have the pandemic, Pandemic. That is an outbreak over a very large area, a worldwide area. And we probably have heard in the news about the H1N1 virus. It's a kind of flu virus, and it was declared a pandemic, which made people kind of scared. But all that meant was that it's out there around the entire world. It doesn't say anything about how dangerous the virus is. It's just saying it's spread around the world. Okay, so that covers the infectious diseases. And the last type of disease or disorder that the textbook presents is the congenital disorder. Congenital. Congenital. Congenital disorder means that it's present at the time of birth. There are three subtypes of congenital disorder. The first one is the developmental disorder. Developmental, developmental disorder, more commonly known as a birth defect. Now, in a developmental disorder, something just doesn't quite develop. A good example would be a missing toe, or maybe the baby has an extra toe because an extra one developed when it wasn't supposed to. The second type of congenital disorder is a prenatal influence. Prenatal, Prenatal, which literally means before birth. And a prenatal influence that could cause a disorder would be, for example, if the mother drinks while pregnant, the baby can develop what's called fetal alcohol syndrome. Another example would be if the mother caught a disease, like say rubella disease, otherwise known as German measles. That can cause harm to the fetus as it grows. So that would be another bad prenatal influence. And the third type of congenital disorder is a birth injury. A birth injury is something that happens during the process of birth. A fairly common example people have heard of is cerebral palsy. cerebral palsy, PALSY. During the birth process, the baby lacks oxygen, and this fact that the oxygen was cut off causes some brain damage. Okay, well, that covers the terminology related to the types of disorders and the causes of disorders. And so now we're going to do some practice. What is the term for a type of disease or disorder that is caused by a pathogenic organism? That is an infectious disease. infectious. Infectious disease caused by a pathogenic organism. What is the term for a disorder that occurs as a result of a medical treatment for some other condition? That is an iatrogenic disorder. iatrogenic. Iatrogenic disorder. What is the term for a disorder that has no known cause? That is an idiopathic disorder. idiopathic. Can you tell me what is an organic disorder? An organic disorder is one in which the symptoms can be explained by physical changes in the body. What is the term for a disorder that is present at the time of birth? That is a congenital disorder. congenital. What is the term that describes the ongoing presence of a disease within a certain population? That would be endemic. endemic. What is the term for a hospital-acquired infection? The answer is nosocomial. nosocomial. What is the term for a disorder that does not cause any detectable physical change in the body? That's a functional disorder. functional. A functional disorder is a disorder of function, but there is no obvious organic or physical changes in the body. What does the term vector-borne transmission mean? Vector-borne transmission means that the disease is spread by insects or animals. And what is the term for the study of the causes of diseases? Well, that is etiology. etiology. And what is the term for a disease, specifically an infection, that can be transmitted from one person to another, either directly or indirectly? Well, that's communicable. Communicable is COMMUNICABLE, communicable. And finally, what is the term for a type of congenital disorder that occurs because of something the mother has done or something that the mother has been affected by? Well, that's a prenatal influence. Prenatal, prenatal influence. An example of that again is fetal alcohol syndrome. And this ends this episode of the Medical Terminology Podcast.